I am Dr. Manish Mahendra, cataract and refractive surgeon at Mahendra Eye Institute, Kanpur. I'll be talking about flanged intrascleral IOL fixation, Yamane technique. So I'm going to show you a Yamane technique, which is an intrascleral fixation of IOL. So I use a toric marker here, and you have to place it at 180 and 0 degrees. Now the next step is use a caliper and measure 2.5 millimeter. So we mark 2.5 millimeter posterior to the limbus horizontally and vertically on one side and do the same procedure on the other side in an inverted S shape. We make two side ports, and this is very essential. This is followed by an anterior vitrectomy. Now we do an thorough anterior vitrectomy to clear all the vitreous in the anterior as well as in the pupillary plane. We make a main incision, and now we are loading the three-piece lens. I'm using a three-piece lens, an Alcon MA60AC, which has PMMA haptics. Now you gradually insert the lens and place it above the iris. And you make sure that the leading haptic is lying at 6 o'clock position. Now using your 26 or 30 gauge needle, move through the sclera, turn at 2.5 millimeters, enter behind the iris in the pupillary plane. Next step is to feed the leading haptic into the lumen of the 26 gauge needle with the help of the microforceps and gradually externalize it as shown. Once the haptic is externalized, hold it with the microforceps, dry it with the help of a Murosol sponge, and now using the heat cautery, you flange it, making sure that the heat cautery is placed a little away from the tip of the haptic. And you can see how nicely it gets mushroomed out and flanged. Now do the same procedure on the other side. Use the 26 gauge needle, pass it through the sclera, hit the 2.5 millimeter spot, enter behind the iris in the pupillary plane, and now we dock the other haptic. Notice how the trailing haptic is placed outside the main incision. This will help easy insertion of the haptic into the lumen of the 26 gauge with the help of microforceps. Make sure to thoroughly insert the haptic in the lumen so that it does not get dislodged while externalizing the needle. Once it is docked, now you slowly withdraw the 26 gauge needle and you externalize the other haptic. As you do so, make sure to hold your haptic with the microforceps or your McPherson forceps. Then you dry the tip of the haptic, and in the similar manner, you do a heat cautery and you flange the tip of the haptic. Once this is done, now you center the optic. So you now have a beautifully centered IOL. Insert the tip into the sclerotomy so that it's not exposed. And this is followed by removal of the viscoelastics by the help of a bimanual technique. And then the side ports are hydrated. Thank you for watching the video.